Hi, I'm Dr. Sunil Reddy, a consultant neuropsychiatrist at Himagiri Hospitals, Gachibowli, Hyderabad. So, today I'm going to brief about sexual dysfunctions. So, in sexual dysfunctions, we usually categorize in three problems like erectile dysfunction, premature ejaculation, and anxiety performance. So usually these three won't exist as a single entity. Somebody feel like some erectile dysfunction and of course premature ejaculation. Somebody have a problem with anxiety performance and premature ejaculation kind of. So let's go to erectile dysfunction. As per data worldwide, men are suffering, about 1/3 of world population is suffering with a sexual dysfunction. In that 60% were erectile dysfunction. So what is erectile dysfunction? It is inability to perform a coitus with a firm penis. So even they don't feel that desire to perform a sexual act. Even this is also considered as a erectile dysfunction. So today we are going to discuss about the treatment options for a sexual dysfunction too. So what is premature ejaculation? After erection of the penis, so without coitus, they may void the semen. So this is nothing but premature ejaculation. So they don't go to an orgasm in the sexual act. So even the partner, even men won't feel that orgasm. So during the sexual act, they won't feel orgasm, they avoid the semen. So without any sexual satisfaction, this is nothing but a premature ejaculation. What is performance anxiety? So during men, sexual act, they won't enjoy the sexual act and they lose their potency and they lose their rigidity of the penis. They won't go for a orgasm kind of sexual act. So they void, even they suffer with premature ejaculation too. So these are all kind of anxiety during sexual act is as a performance anxiety. For this, we have a natural kind of treatment for a sexual dysfunction. That is nothing but shock wave therapy. Let's discuss about the shock wave therapy. This shock wave therapy we usually give directly to the penis. Don't be stigmatic about the shock. It's not even an electric shock, it's a sound wave therapy. So in certain edges, we activate the tissue in the penis. So it generates neovascularization, means new vessels in the penis. So by activating the tissue in the penis, like it's a smooth muscle content, it's different from another body skeletal muscles. Like usually we have a skeletal muscles in the body, like for work kind of, like we hand and legs. In abdominal muscles are skeletal muscles, but the tissue in the penis is different, like it is a smooth muscle. So it has a very unique functional act. So to activate this, or of course for a skeletal muscle, we have a physiotherapy and exercise to activate those muscles. But perineal smooth muscles, they don't have any exercises. So by giving shock wave like a sound wave therapy, it is activated and it generates a new vessels in the penis and it withstands the erections so that they can perform, and we can treat that erectile dysfunction without any medications. That's the best part. We have no side effects with the shock wave therapy, and there is zero side effects. So without any chemical induction or without any injections to the penis, or even we don't need any anesthesia too. And it is a very OP procedure, like day-to-day act. It may last for 10 to 15 minutes. So but we have to take it for a sessions. So depending on the problems, we give for a sessions like the 6 to 8 sessions, weekly sessions. So with that, the performance of the men increases without any side effects. So the best part of the shock wave therapy is without any medications. of course, we treat the erectile dysfunction. The procedure is something different, like we examine the client. So we denote as a client because sexual dysfunctions are very emotional. So we do treatment them as not as a patient, we call them as a client. So obviously we have to listen them, like a first history taking. So what is their problem, what actually they are facing. Then we conclude the diagnosis with some simple physical examination techniques. Of course, we examine the genitalia, and we go for a simple lab test like a hormonal test and nutritional test, and we come to the diagnosis, and we post for a treatment management. That is nothing but a shockwave therapy. In shockwave therapy, on conclusion of diagnosis with a history, we give certain sessions. With that sessions, male will improve their activity week to week. Like their dysfunctions will come down, and they can perform good sexual act. Even partner will accept the things. They see a real improvement without any drug. So of course, we do, as most of the people go directly to the medical shop, ask for simple medications without knowing their side effects. But it is the best way. Shockwave therapy is the best way. Of course, we do prescribe some medications to recover from that things. It's best to go for a shockwave therapy, and hope you will use it. Thank you.